COVID-19 cases are rising again, and we are seeing the highest number of infections since the pandemic began. And now that more of us are getting vaccinated, we want to talk about how they work. How can we be protected against the new variant? When are booster shots needed? And why we should not let our guards down? I'm Dr. Freddy Gomez. You're watching Med Talk Health Talk on CNN Philippines. Since the first outbreak of the coronavirus in 2019, experts were working tirelessly to come up with vaccines to combat it. And each of them went through rigorous testing to ensure their quality, safety, and efficacy. Today, there are 9 COVID-19 vaccines approved for use in the country. Let's welcome our guests for today. With us is Dr. Mark Edsel Ayes. He's the Clinical Genomics Laboratory Head at the Philippine Genome Center. We're also joined by Dr. Adrian Buensolido. He's the chairman of the Infection Prevention and Control Committee of the Asian Hospital and Medical Center. I'll start first with Dr. Adrian. We often hear of efficacy numbers, but what do they actually mean?
Efficacy just means how good a vaccine is at preventing disease. For example, in COVID, all our vaccines are very good or efficacious, at preventing severe and critical disease.
So I'd like to ask Dr. Ed, in general, the higher the efficacy rate, the better a vaccine is. But is that still true? Does that still hold true with all the variants that are here today?
Efficacy, as Dr. Buensolido mentioned, that's what you see in the clinical trials. And clinical trials are designed in such a way that you eliminate biases or yung mga tinatawag na observations that can actually cloud your judgment, yung can make the conclusion a bit wrong. So in clinical trials, you have very selected populations. And when you say 95% efficacious, that just means that in that population you observed, you were able to lower the incidence of the disease that you're trying to prevent by as much as 95%.
What is basically the difference between efficacy rates and effectiveness of a vaccine?
Efficacy is what we do in the trials. So that's sort of like the kumbaga before your pre-test, no, bago na lahat. Kasi syempre, gusto mo bago mo isubok yung dapat tested na. Effectiveness is now what's going on, no, in real life, yung practical application basically. So that will be usually it's a bit lower than the efficacy as seen in clinical trials. The World Health Organization recommends at least an efficacy of 50% before it can be deployed in populations. And for this reason, all of the current vaccines, they're well above the 50% recommended. And as far as the current data shows, they're performing very well naman at preventing severe disease.
Let's talk about how these numbers are affected by the more aggressive Delta variant. Why are we having this sort of situation right now in our country when a lot of people are getting vaccinated and such, but we're still seeing high numbers of infectiveness, hospitalization, and everything? Why is that happening?
Now you might wonder, we're getting vaccinated. Unfortunately, this outbreak is occurring at the same time that we are trying to vaccinate our populations. So, it's very tempting to make that conclusion na we're vaccinating pero ang dami pa ring nahahawa. But you have to put it into context. When the Delta variant started entering and there were many cases being detected, we had only just breached 10% of our population that had been fully vaccinated. So to blame the infections on vaccines that are not working is actually missing the point. We have still to vaccinate a large number of people in order for it to see the effects of it protecting the people.
Dr. Adrian, paliwanag natin ito na mabuti. Bakit hindi effective kapag isang dose lang at dapat kumpletuhin?
Ang bakuna kasi, it really just it trains our immune system. It allows our soldiers, to recognize the virus before the body even is encountering the virus, so that when it finally encounters, hopefully not, but finally when it encounters the virus, in real life, the soldiers will be able to recognize the virus and attack it early on, and hopefully prevent a disease from happening or from occurring.
So why is the second dose administered almost at sometimes a month, sometimes even longer after the first one is given? What can you say to those people? How can we encourage them to complete those doses?
Really just have to tell people that one dose is not enough. No? We have to understand that the design of these vaccines is you get the maximum protection from it if you get the 2 doses.
Dr. Adrian, how about the side effects? How about a lot of people are worried they don't want to get the vaccine because of the side effects?
All of the vaccines are actually pretty safe, no? And if there's one number, let's really all of them are less than 1% in terms of having serious bad effects, serious adverse effects, no? Of course, we have to differentiate yung adverse effects from reactogenicity symptoms. We mentioned training. When the soldiers in our body, our immune system starts training, diba? Many times we might feel them starting to train, no? Siyempre, gumagalaw yan. Ang mga sundalo, pag nagsisimula mag-training, gumagalaw. And therefore, there are reactogenicity symptoms which are expected symptoms. Yung mga talagang alam natin na talagang pwede talagang mangyari, pero hindi masama, no? And what are these? Fever, pain, no? Weakness, no? So sometimes a little bit of chills, no? So body aches, no? These are just symptoms that are telling us, our immune system, it's now working, it's now training for the battle later on.
No COVID-19 vaccine offers perfect protection, but they're effective in preventing severe COVID and even death. When we return, we'll talk more about how antibodies work. Stay with us here on Med Talk Health Talk. You're watching CNN Philippines.